Welcome to Understanding the Israel Medical System in 30 Minutes. I'm Aviva Yoselis. I'm going to be your guide here. I am founder and CEO of Health Advise. I will tell you briefly about my background in a minute, but we are going to cover the basics here of Israeli healthcare, the nuts and bolts, and a newly revised edition so that you can really understand what it is that you need to know about the system to make sure that you feel empowered and that you are getting the services and the healthcare that you need and deserve. I am a little bit more about me. I am living here for 26 years in Israel. I have a background in public health and health promotion from the United States and Israel. I have a master's in public health, and I am also a board certified health advocate. I run a company called Health Advise, and I help people navigate the complexities of the healthcare system, whether it be finding the right physician in order to get a diagnosis, to helping get your children or your adult children the care that they need or the social services and benefits that they need, helping people bring their parents over, making aliyah, also helping their parents get the right services if their healthcare situation changes. That's just some examples of what we do. Over the years, I've worked with a number of organizations. You can see them here just to give you a sense of both government, nonprofit, for-profit organizations all talking about and all working on this issue of advocacy, accessing rights and benefits, especially for English speakers in Israel, where I feel that there is a bit of a lack. So first, we're going to just jump into a general overview of how the system works to give you a sense of if you can put all the pieces of the puzzle into place. In general, there are three types of insurance that work in this system. The first one is the National Health Insurance, which is guaranteed for every permanent resident and citizen. You have a basket of services. We're going to talk about that more in a second. That is guaranteed for you by the government. And every year they vote on what prescriptions, imaging, procedures, types of appointments will be in that basket of services. It is pretty comprehensive, especially any type of emergency surgery, procedure, etc. is for sure in there, as well as many regular medications, imaging that one needs to have. The nice thing about this is that it has nothing to do with your age or pre-existing condition. So when you move here from another country, you are fully covered. The second option is what they call private or supplemental health insurance. And that is something that you need to purchase through your Kupat Cholim, which there are four. We'll talk about that in a second. You purchase it. It provides you additional coverage of services or procedures or private visits, second opinions that are not included in the regular basket of services. But again, your age or pre-existing condition does not have any effect, so you may purchase this at any time. I always recommend to people who are new Olim that they purchase this supplemental insurance within 90 days of their aliyah, because then there is no waiting period in order to be eligible for a variety of services. Otherwise, if you purchase it later on or years later, there is a waiting period anyway from 3 to 24 months for various procedures. So it does behoove you to purchase that early on. And the third is completely private health insurance, which you can purchase completely privately. It's more expensive, or sometimes if you work in a larger corporation, they give this as a benefit to the employees where you can purchase the private insurance at a much lower rate for you and your family members. That offers you similar to what the supplemental insurance will offer you, as well as additional medications or procedures that are not connected or not incorporated in the private in the supplemental insurance. They can reject you there on the basis of age or pre-existing conditions. So that's something to know. In general, it is not, it can be beneficial, and I recommend everyone who has purchased that to make sure that you get the complete policy. It's in Hebrew usually, not the English summary, but the complete policy, because not all policies are the same, so that you can know what your specific benefits are for having that policy. And I recommend that you read it so that you know what you can be reimbursed for or you can receive initially. It is not critical. A lot of people, especially those coming from the United States, feel that it is critical. It is not critical. You can have perfect coverage already with a basket of services, but I do recommend that unless you are severely financially strapped, that you do purchase the supplemental insurance because it really allows you a much wider array of services, including the ability to choose a surgeon if you need surgery and to get a second opinion at a subsidized rate because otherwise it can be quite expensive. So just to dive in here a bit more into how things work, if you see here on the left, we have the bituach leumi in the blue box. That is the government body that provides the health care for all citizens and permanent residents. They pay a certain fee to, as you can see in this rectangular box, the kupat cholim, and these are the four kupat cholim that are available. They pay them to deliver the healthcare services to your family. Here's our happy family of immigrants. They're living here. They are in their picture. And in order to get all the care that's provided in the basket of services, you see in the right hand corner, all the baskets, all the services provided in that basket. In order to be eligible for that, you pay a tax to bituach leumi, either through directly in your work, it's 3% that comes off of your salary receipt, or if you receive a government stipend, it also comes automatically off at 3%. Or if you aren't doing any of those things and you do need to pay directly, I believe now the minimum is 174, which is bituach leumi and the health tax. If you are over retirement age, you only have to pay the health tax, but that does need to be paid into the system to be eligible for the free or subsidized care. When I say free care, I want to just clarify, if you see in the little box over here on the right hand side, all family doctor visits are free. If you see a specialist, it's 27 shekels a visit. And if you need what they call a tofes shvasei or a hitchayvut, which is the voucher of the kupat cholim that says we will pay for a procedure that is given to anything that is performed outside of the kupa, like in a clinic, a private clinic, like a machon mor, or in a hospital setting, you will need that form prior to the procedure. So that's important to know that you must come with that form. Now, in addition, if you want to purchase the supplemental health insurance, or you want to purchase the long-term care insurance, and we'll talk about that in a second, you can pay extra money to the kupa, and you will receive this additional mushlam services, which include 3 or 4 second opinion visits to doctors, being able to hire your own surgeon, etc. You may also pay for long-term care insurance, which is if something happens to you, you need, and not through a car accident, by the way. The car accidents you are not eligible to access the claim. But if something happens to you and you've been paying in this premium, which is age-based, so anywhere from can be 15 shekels up until over 100 shekels a month, you've been paying that premium, and you have a point where you can no longer take care of yourself, or you need assistance with your activities of daily living, which is bathing, dressing, feeding yourself, shopping, house cleaning, etc., then you can get anywhere from 35 to 5,000 shekels a month in cash to your bank to do with whatever you would please, which is usually goes to either a foreign worker, or if you need assistance and you need more equipment, etc., in your home for whatever illness you have, then you can use that funding. So those are important things to know. They are different. Just because you have purchased the supplemental does not mean that you have the long-term care or COD. It is a completely different policy. It also has nothing to do with life insurance. That's also important to note. That is something else completely. It's important to understand that the system is made of 2 separate pathways. We have the public system, as I mentioned, which is paid for and is run by bituach leumi, and we have the private system, which you can access through your supplemental insurance, or pay completely privately, or completely private insurance if you have that. The public system offers you everything that is in the basket of services, which is constantly being updated and added by the government. You can choose specialists from any of the clinics in the kupat cholim. Sometimes it might take a few months to get an appointment, depending on the type of doctor and the availability. If you go to a clinic in a hospital setting, you do not choose the doctor. It is whoever is on call at that moment. And the same goes for surgery. If you have, obviously, emergency surgery, we're not checking, but if you have elective surgery, you go to the clinic at the hospital and you are assigned a surgery. You are not assigned a surgeon. It will be whoever is on call at that moment. If you have the private or supplemental, you can get additional payments for medications that are not inside the basket of services. For example, growth hormone through Mu'chedet, as well as um, Viasent through Maccabi. Those are some examples of medications that are not in the basket of services but are eligible for payments if you have the supplemental insurance. You are also eligible to go see a private doctor at a subsidized fee, or you pay up front and you're reimbursed. It's important to note that if you want to do that and for surgery, you just need to verify ahead of time that the doctor has an agreement with your kupa. Not all doctors are necessarily included in this, and you don't want to hire somebody who turns out you'll be charged for all of the costs, including the hospitalization and anesthesia. So that's why you just need to double check ahead of time that that doctor is available through your kupa, a private doctor. Before we complete this section, I just wanted to uh, make a note of some important things that we need to remember in terms of differences. So, the public system is you really need to use these two systems in conjunction. And why is that? Because a Kupa doctor is the one who needs to write a prescription for medication or for any type of imaging that needs to be done. So even if you see a private doctor and he recommends that you do an MRI or any other type of imaging, it is the Kupa doctor who needs to actually do the request in order to be covered by the Kupat Cholim. That's one thing. The other thing is I always recommend to people that you schedule for the specialist then ahead of time, even if it will be a few months. So after you see a private doctor, you will have waiting for you the appointment for the Coupa specialist. As I mentioned, not all doctors who see privately are with your Coupa, so make sure that they're in the agreement. You can do that by the Coupa website. And private doctors can be very helpful because you see them much more quickly. They may have more expertise for your specific problem. However, because of what I mentioned about the need for referrals or imaging from a public doctor, I recommend first pursuing that and making sure that you have all of the imaging and tests and blood tests already together so that when you go see the private doctor, you just won't be set back for testing, but they'll be able to look at the whole picture and give you a diagnosis based on a more informed decision. Now, another aspect of what we talked about is bituach leumi. You can see that this is what bituach leumi offers you. In addition to the healthcare coverage, they also offer a number of other social welfare benefits. It's important to note that bituach leumi stipends are income and medically need based, which means that they don't just look at whether or not you need the help physically because of a disability, but also whether or not you are meeting the financial criteria. So even if you suffer from a debilitating illness, if you are able to work full time and have a full time salary, you will not be eligible for bituach leumi. Or if you would like to apply for the long-term nursing care, but you have received, both you and your spouse receive a private pension and Social Security from the United States, chances are that financially you will not be eligible for the long-term nursing care, even though you are medically eligible. I do urge people, though, to always apply. The worst case scenario is that they'll review the income and say you're not eligible, because sometimes people do the wrong calculations and that can be a shame, and there's nothing lost in applying. Now we're going to take a brief moment to talk about doctors in Israel. Doctors in Israel, in terms of how we access them and what we need to know about them. So I get this question all the time: how do I find a doctor? The first and foremost is the Kupaz website. It can be a very good search engine. Yes, it is in Hebrew. That's why I recommend that people use the site and not the app, because on the site you can choose right click through Chrome um, or Explorer, and you can click on translate into English, and it gives a pretty good English translation of what's on the page. Sometimes the AI makes pretty funny mistakes, but for the most part, you can get a sense of who's available for you. This is especially helpful if you are looking for doctors that are convenient because of timing or proximity, or you just need something quickly filled. So, this is not when you're looking for someone to give you necessarily a diagnosis, or you really want to know what steps to take for treatment, but more you need a refill. You need to see somebody for a routine follow up. You're not, the bedside manner isn't such an issue to you, then this is a really good resource to use. Obviously, there are also Facebook and WhatsApp recommendations, which can be very helpful. And asking friends and family, I just would urge you to choose your several places, groups, or friends that you're going to ask, and not give out to 10 different groups, because you may get 10 different opinions, and that might be quite overwhelming. And I'm introducing a new database that we've just created called israelmd.com, which is an in English database for English speaking providers, where you can provide a review, a rating, as well as see other people's ratings of doctors in a various listing of different types of variables like bedside manner, English proficiency, time till appointment, etc. So I urge you that if you're interested to check that out, and you can also add your own doctors so that you can recommend or de-recommend doctors as you see fit, but that might be helpful also to your friends and family. It's very important to remember the following things before a doctor's visit. And I have the picture actually of the doctor standing up, because I feel that, um, the other picture that I had was a picture of a woman doctor is sitting quietly in a big comfortable office, plenty of times, everybody looks relaxed. But the truth of the matter is that even in a private doctor, you're in a small office, the doctor, there's a lot going on, including the secretary coming in, somebody else knocking on the door to just say they just have a question, somebody else saying, in, is this the office of so and so? So, and yes, often the doctor is actually standing up and writing something because he is already on to the next procedure. But be that as it may, it is very important to remember that you have the time now, and that you should ask all of your questions and not to be afraid, and clarify if you did not understand something. That's why I always recommend for people when they're going to a specialist appointment to write down your questions. Additionally, I urge people to shop around. This is a service based industry, just like others. And just as how in relationships you need a certain level of chemistry, you don't click with everyone, the same is true for a doctor. So if it's going to be a doctor that you know that you're going to have to see on a routine basis, let's say for the next 6 months, or if you have a pregnancy, or you have some type of autoimmune condition that necessitates a routine follow up, make sure that you feel comfortable with the provider. And if not, you can choose and you can change. I also recommend for larger, more important visits, make sure that somebody is with you. And it's also important to let them know what is the goal of this meeting beforehand. So, for example, the doctor is going to give us the results of the biopsy, or the doctor is going to give me what he thinks is the treatment, or I am going in to say, can I change the treatment because this is not working for me? Those kinds of things. It's important that the person who's with you understands the goal, and they can also listen and have another set of ears and eyes in terms of what the doctor is saying. And the most important thing is that you need to get a printed copy of the doctor's summary of visit. It's called the Sikum Bikor in Hebrew. It is crucial. And yes, I'm talking about a paper copy, even in today's digital age, because that is what is the summary of what happened. And that is what you need to bring perhaps to other specialists. You don't want to rely on the fact that things can be accessed on the computer. Sometimes it happens, but oftentimes there's a technical issue and they can't access your files, or you're at a private specialist who doesn't have access to those files. So one day everything might be connected digitally, but for now, make sure that you have a printed copy always of the doctor's summary. This is different than the prescriptions that he's given you or the referrals. Make sure that you ask for this is called Sikum Bikor. Now we'll talk about emergency care, which is another important aspect of Israeli healthcare. In Israel, we have three different places where we can go to get urgent care. I'm going to start with the ER, the emergency room in the middle, because this is where people are most used to go. But in if you don't have a referral for the ER or you're not in a serious emergency, then you will be charged for that visit. And I have to say that both the ambulance companies and the Kupat Cholim have become much better and more organized about billing people so that you will receive the bill if you do not have a referral. So when can you go to the ER with no issue? When you are unconscious, when you have a complicated or open fracture, when you have a car accident with a police report, and between 1 and 6 a.m., you can go to the emergency room. You can also go if you have a referral, either from a doctor or the moked, which is the urgent care of your kupat cholim, or you've called them and you've spoken to a nurse and she has given or he has given you the referral and sent it into the emergency room. Then you can happily go to the ER. Otherwise, you're going to choose either from Terem or urgent care or your Kupat Cholim. So, what is Terem? Terem is places that you go when you need immediate care, but it's not an emergency. So, for example, you think you broke your arm or you have an open wound on your head that perhaps needs stitches, you're not feeling well, you may have a fever. Sometimes, especially now with Corona running around again, perhaps you have a cough, but you're not in dire straits. You go there first. You go and you check out to make sure to see what it is, and they will either treat you and send you home or give you a referral to the hospital if they feel that it is not something that they can resolve. And the last one is the Kupat Cholim clinic during the day hours. I'm not feeling well. I think maybe that I have, some kind of illness. It's not going away, etc. That is when you go to the Kupat Cholim. You can make an appointment. Some Kupot Cholim you can go in at certain hours, and you'll just wait around and then they'll take you. What is very important to know before it is an emergency time is which office does your Kupat Cholim require you to go to? Is there a Terem in your nearby area? And does your Kupat Cholim work with them? If not, do they tell you to go to this clinic in after hours after 4? Do they tell you would they give you an option, or you live in a geographic area where there's only one option? So it's very important to know ahead of time, and then you can ask the secretary, you can look online, where do I go in an emergency situation where I don't need the ER? Additionally, a resource that I wanted to tell everybody that's important as well is that all of the Kupot Cholim give you the ability to order a doctor to come visit you. Usually it can be anywhere between 80 or 150 shekels. However, if you're over 80, the visit will only be 20 or 25 shekels. These doctors will come to your home. It's not immediate, but this works well for somebody who's just really not feeling well and can't get out of the house, but it's not an emergency, or someone, let's say, with dementia, where getting them into the car and getting them into the clinic is extremely difficult, or they're wheelchair bound, but they don't have home health care services, or they need something that is not routine. So I recommend that you make these appointments. It can take anywhere from 2 to 6 hours for the doctor to come, so it's not immediate, depending on how what is the how busy they are. These doctors are generalists; they haven't yet done their residency, so they are not experts necessarily in the field, but they can for sure do the initial assessment, and this can be very helpful in the cases where you don't want to leave the house. And to final summarize, what are my 7 principles that I believe that you should take into account is to, you can read them for yourself, but first and foremost is to have confidence in yourself that you need the answers, and that you can receive the answers. I do not recommend yelling or cursing or even crying. I've seen all those things in the clinic, but they don't necessarily move your point across. However, I do tell people just keep repeating gently but consistently what your question is. If you don't feel like you're getting an answer, you can always ask for a manager and move up a level. And remember that I don't know is not an answer. I also urge people that if you feel that things aren't moving along, speak in English. even if the person in front of you doesn't have good English. Therefore, it puts the responsibility on them to maintain the conversation and not you. And you also feel more empowered when you are speaking in your native language, so that you also come across as a stronger figure. And the final issue I leave you with is really choose your battles. Is this issue crucial to you? So, am I having an argument about the 37 shekels that I paid here for the hitrevut that I didn't end up using? Is it worth my time to pursue it in order to get a refund, or is that time better spent on something else? It can also mean that no, my child is eligible for these auxiliary services that we haven't received. And now I will make all the calls necessary. I will write the letters and write the emails and keep pursuing until we get the resolution that we deserve. So that's a choice, and that I think you need to have a thought process about that choice, which leads into our final concept is that as much as we want somebody else to be the case manager, for whatever reason, this is no longer the case. It is you. You use the physicians and the system and the nurses and perhaps the social workers all to help facilitate your case and your situation, and that's what they're there for. But at the end of the day, you are the one who is managing, so you are the one who really has to sort of know how things work and the one being in charge. So thank you so much for allowing me to guide you through this complex world of healthcare. I urge you to contact us if you have any questions or comments. We are available through email. We have a website, as I told you, our database. You can WhatsApp us or call us or leave a message, and we will return your call as soon as possible. Remember, we are not a crisis organization, so our returns are often between 1 and 2 business days. However, we are out there for you. We answer questions, and if you have a more complicated healthcare problem, we are always happy